Assalamu alaikum rahmatullahi wa barakatuh, everyone joining us here in a brand new session of your program, The Medical Files, with myself, Saima Aziz. So, well, dear viewers, we are back again with you this week, and we are going to be talking about something very interesting and very new here in the Kingdom of Saudi Arabia. As you all know, last week we spoke and discussed in the studio about premarital testing, as this is the season for marriages here in Saudi Arabia. Summertime is usually the most popular time of the year where we see a lot of marriages happening. We hope that you found our last week's episode useful, and also this week we are going to be talking about something very newly introduced here, as I said earlier. Now this is a one-day dental treatment. We are going to talk to you and tell you more as to what it really entails and what are the services that you would be possibly getting. Does it ensure that you are going to walk into the clinic with not so confident smile and you would be coming out, you know, flashing all your teeth out? What is really the service that they are offering in these one-day dental clinics? What are the places where you can possibly acquire those services? How useful are they, and how much would they cost you, and how easy on the pocket it would be? We're going to be talking about all those things in tonight's session of your program, The Medical Files. Now joining me in the studio are our doctors from Dr. Abdulaziz Al-Ajaji Dental Polyclinic. Joining us is Dr. Ahmed Ali Khanaan, who is a dental implantologist. Assalamu alaikum and welcome to the program, Dr. Khanaan.
Alaikum assalam.
As well as joining us along with Dr. Khanaan is Dr. Antonio Flores, who is a specialist in root canals. So, Assalamu alaikum and welcome to the program.
Alaikum salam, thank you.
Now, Dr. Antonio and Dr. Ahmed, we will be talking about this one-day dental treatment, but first let us know a little as to when was it actually introduced here? I mean, you know, we've been hearing it, that it is new. So how long it has been here?
In Saudi Arabia, one-day dental treatment is a new thing. It's very popular in Europe and the USA. Not a lot of clinic has it, and it's not eligible for every patient, so you have to be a little bit specific and selective with the patients that you choose for the one-day dental treatment. We started the program about 6 months ago, and we had some patients. We kind of was a kind of trial and testing, so we kind of finalized the whole thing, and now we know what to look for exactly.
So now you said that not everybody is eligible for it. Fine. Now let's to move on, Dr. Khanaan, and talk a little bit about like this one-day dental treatment. I mean, you know, what does it have? What does it offer? Which is like, you know, so alluring to the people. I mean, as you're saying that it's just 6 months old in the kingdom.
The whole concept of one-day dental treatment started by, we know that these days a lot of people are busy with lifestyles, traffic is very bad, so people want to get as much as they can done in the shortest period of time. We have a lot of patients coming from outside Riyadh, some of them outside the kingdom. Also, we know some patients are apprehensive and they can't go to dentist so many visits. So we decided to employ our latest technologies and our specialists utilize the latest technology in dentistry to find a program, do a program that serve all these patients there. So one-day dental treatment, we have to be selective. So depending on what equipments do you have in the clinic, who's the specialist that you have, can they do their specialty in one day or not? So it's selective. So we'll talk a little bit about, you know, what kind of patients we be eligible or what patients are not eligible.
Certainly. Now, Dr. Antonio, coming to you, you are an endodontics expert. Now, tell us a little bit about your intervention in this one-day miraculous treatment, as it sounds like.
Okay, what mainly we have to do, or at least in my expertise, my field, it's relieve first the pain in the patient as soon as possible. Any tooth that has an ache or something, relieve it. Go ahead to do the root canal. That will be just removing the nerve, doing the ASAP, in order for him not to feel any pain, and get a filling, permanent filling inside the root, for it to be able to achieve afterwards a very good restoration, either a crown, veneer, or what it's going to do. And removing any kind of infection microorganisms that are dealing with within the root canal or its surrounding tissues.
And actually, Dr. Antonio, the reason that I asked you that question is because when we hear about, like dental implants, we know, okay, this is really immediately going to enhance the look of a person. But with endodontics, it's like, all the internal stuff, stuff that you pay for, but it doesn't like, look like you did anything on the outside. But so pain relief is also an integral part of this one-day dental treatment.
Yes, it is. And the outcome to achieve a very good restoration, a nice smile to a patient or something, you need to get a good root canal treatment. That's root canals are like the basis of the later on treatment, of the permanent treatment afterwards. With a bad root canal, a crown can fail in no time.
Now, Dr. Kenan, coming to you, let's talk a little more about, this one-day dental clinic, because I am myself very, very intrigued. I mean, I never really knew about this one-day dental treatment until I spoke to you. And as to what services are you exactly offering in this one-day dental clinic, one-day dental treatment? I mean, because, it really is sounding like, okay, a lot is going to be done all within the period of one day. And now, what is it exactly that this treatment entails? What are the priorities in this treatment? I mean, is it just the outlook, or Dr. Antonio talked a little bit about the endodontics and the root canal, so that means that you're like giving attention even to the root cause of the problem, and then at the same time enhancing the look. So what is exactly going on?
The one-day dental treatment is not, by the way, done by one specialist. It's a collaboration of all the specialists in their field. So the way it works is a patient comes in, the plan is a patient comes in, we'll treatment plan, we'll make him a treatment plan for whatever need to be done. And then we have to sequence the treatment plan, okay? So we have to say, what has to be done? Let's say the foundation, the root canal has to be done first, and then the specialist, with the crown and bridges specialist will come and will do his part, and then the crown will be done. So we have to kind of sequence the treatment plan according to that. We can do, with the technology that we have, we can do root canal, like Dr. Antonio said, in one day. After that, we have to do the post inside the tooth to give the tooth a support and build up the tooth. And then after that, we can do the crown. All that can be done in one day. So we have the lab that can support us. We have the machines that can mill and make the crowns in one day. Of course, we can do fillings. Everybody does fillings in one day, so it's not a big deal. So the specialist of the fillings, the cosmetic dentist, will come in, will do his part also. We can do cleaning for the patients. That's also will make one part of the treatment, the patient to come in or the doctor to come in and do the cleaning on that patient. We can do implants. Let's say you want to get a tooth extracted and you want to do an implant the same day. We can extract the tooth and put an implant the same day. If somebody's missing a tooth, we can do an implant for that tooth in the same day. We'll have the crown put in. So we leave that, let's say it's a front tooth and you're missing for 20 years. We can put an implant in one day and put with the crown. That's part of the whole treatment. So you're getting everything done, including that too. That's the whole thing about the one-day dental treatment, is how can you do everything done in one day.
Okay, now, Dr. Kenan, this sounds like, a dental spa. Just like, when we go to a spa, you get like everything pretty much taken care of, especially, given you spend like particular hours there. So now, this one-day dental clinic, you mentioned a lot of things just now, which can possibly be done all in the period of one day. But however, how is it, on what basis is it decided that what are the services that a particular client, I mean, perhaps they might not be patients, they may be just, a client. So how is it decided that what are the services that you are going to provide, as not everybody would be needing implants, or not everybody would be needing fillings. So how is it?
Before we get the patient for the one-day dental treatment, we have to examine the patient before. So we'll see what the patient expectations, what do they need, do they have those criteria that they need it done in one day, are they afraid, are they busy, are they coming from out of Riyadh? So we have to set up first an appointment with we call it the case coordinator, which is I'm the case coordinator for the clinic. So I examine the patient, I'll make a treatment plan, examine their mouth, find out what they need, and then we'll see, we'll offer them, you are eligible for the one-day treatment. Do you want to go ahead with that? We offer the patients options. We can do it either under local anesthetic, local shots, just injections, or we can do it if they want to be asleep. We can do it in the hospital, at Sulaiman Al-Habib Hospital. We can do it when they're asleep. So if they want to scare of the dentist and they want to sleep and wake up, they're gone, they're finished, we can do that too. But we're mainly focusing on the regular patients on a regular anesthetic.
So most of the services you prefer to give as an outpatient procedure.
Exactly, and like I said, we examine the patient, then we decide are they qualified. If let's say a patient comes with a big abscess like this, and you know what, I want to get 1-day treatment, I want an implant done, you cannot. If you extract that tooth, you have an infection, you cannot put an implant, otherwise it's going to fail. So that patient is not eligible for the 1-day treatment. Yeah, if a patient comes in, they need, let's say, let's say 10 crowns. You cannot offer 10 crowns in 1 day. Why? Because the lab cannot finish 10 crowns in 1 day. If you go to a clinic that don't have an in-house lab and they use outside lab, they cannot finish the crowns in 1 day. So again, it depends on what your facility has and what can you do in 1 day. So again, it all depends on the examination and determination whether they qualify or not. So again, like I said, not everybody qualifies.
Well, dear viewers, we are going to ponder more upon those lines. We are going to find out a lot more about the 1-day dental treatment, a new concept here in Saudi Arabia. But for the moment, we are going to go and witness this report which the team of the program has prepared. So stay tuned with your health show, The Medical Files, and we will be back shortly live on air right after this.
Well, the symposium is a recopilation of all the international speakers that have contributed to make this a successful conference for us, and at the same time to share knowledge with all the applicants and participants in the symposium. This is a 2-day conference that will increase the knowledge about dentistry in the kingdom, and at the same time it will enhance the alternative of 1-day dental treatment for our patients. Well, the thing is that the number of patients in the dental clinics is increasing, as it is the whole population of the country, and at the same time we see that the challenges that we are facing are greater day by day. So it is very important to bring knowledge and new advances and new experiences to assist our dentists to give a better service to our communities.
I'd like to welcome the Saudi TV channel too, and actually it's an honor and pleasure for us the attendance of Prince Faisal bin Abdullah bin Abdulaziz and the attendance of Dr. Abdullah Rabia, the Minister of Health. It's an honor and pleasure for all the medical field and especially the dental field. Actually, our conference today, or our symposium, the title of our symposium is Dental Treatment in 1 Day. In our dental treatment in 1 day, we are targeting 3 groups. We are targeting the patients, they have a dental phobia, and we are targeting also the patients that they don't have time for several visits to a dentist. And also we are targeting the patients that they are living far away from the centers or dental centers. So we are trying to send a message to those patients that by the availability of the new modern technology in dentistry and the highly qualified and specialized dentists, we are able to provide the dental treatment and dental service in 1 day. Maybe if anyone can hear this one, he may have a question, how can dental treatment can be in 1 day? We can inform them that dental treatment can be in 1 day with the help of a modern technology like the CAD-CAM system, which is a camera connected to a milling machine. This camera can take an optical impression instead of the usual impression. Maybe anyone of the audience, he went to a dentist and he was taking an impression. Now there is no need to take an impression. The camera will take the optical impression and we can send it to a milling machine. This milling machine can cut the porcelain at the precise size of the preparation or of the cavity, and then the dentist can take it and fit it directly. So by the help of the modern technology like the CEREC machine, like the laser and all the other technologies, we are able to provide the dental service in one day.
And welcome back everyone to tonight's session of your program, The Medical Files, with myself, Saima Aziz, as we are talking about the one-day dental treatments coming to Saudi Arabia, and we would be talking a lot more about them with our guests in the studio. We have got Dr. Ahmed Ali Khanaan and Dr. Antonio Flores. Now, Dr. Ahmed and Dr. Antonio, before we move back to our main subject of discussion, let's talk a little bit about this conference which was held here last week, and what were the main points of discussion during this conference, and especially pertaining to the one-day dental treatment.
The conference was 2 days. 2 days. The first day we had speakers, we had workshops actually. We had speakers coming from Turkey, we had from Sweden, from Germany, from Lebanon, and from the US. It was a different workshop. We talked about the laser, what can you do in laser technology in one day. But the focus was about those technologies, not about the one day too much. The second day was mainly about, half of it was about the one day. The first half we had speakers from Germany, US, Sweden. They talked about different specialists, what can they do in one day also. And the second half was the doctors of Dr. Abdulaziz Al-Jaji Polyclinics. We were discussing the cases that we did and what's the one-day dental treatment entitled, and what's the whole focus of the one-day dental treatment.
Certainly. Now, coming to you, Dr. Antonio, now let us to talk a little bit more about, the part where we discussed all the functions. And so in order to have good teeth, or to maintain, a good look even for the teeth, if we just talk about the aesthetics, how important it is that you are going to have like the proper functioning in order to have the perfect smile?
Okay, mainly we have to gather together almost all the topics, almost all the specialties in dentistry. We need to do, as Dr. Khanaan mentioned, it's a whole team. We need to gather together to see what is to be done in each tooth, what teeth are useless, what teeth we can save, we can work for them in order for them to stay in the mouth, and determining what treatment for each tooth. If the tooth needs a root canal, if the tooth is going to stay with a crown, if the tooth is going to get a veneer or something. And as soon as everything is discussed, the treatment is overcome, we finish the treatment, then a proper maintenance will be around 6 months, every 6 months going back to the doctor to check the crowns, the veneers, the fillings they got, to see how everything is doing. But it's mainly like everything. Everything needs a maintenance. Cars, we need to take them every 5,000 kilometers to get maintained, to see how are they working. The same happens with teeth. The teeth are in a very, very tough environment, that it's the mouth. Saliva is has around most microorganisms, bacteria that it can gather. So we are exposed every single day, every single hour to reinfection processes or something. So we need to keep on looking forward, keep on maintaining and getting acquaintance of what we really did, that it's working on the proper way.
Certainly. Now, coming back to you, Dr. Khanaan, let us talk a little more upon the eligibility of the patients. Now, this one-day dental clinic procedure, who are the people who are the best suited for it? I mean, do you check for people with chronic illnesses? What is the age criteria for this one-day dental clinic as well?
Again, like we said before, we depending on the treatment plan, what can we do in that day. Again, we exclude some patients, by the way. So terminal illnesses or long chronic illnesses, we exclude those patients. For example, if somebody have high blood pressure and we have to do a lot of work on that patient that day, he has to get a lot of medication, a lot of anesthetic. Sometimes it raises the blood pressure, so we kind of be careful about those patients. If a patient have a liver dysfunction, some problem with the liver or with the kidneys, if we give him an anesthetic or the shots, it doesn't get out of the system, or called the clearance rate is a little bit lower. So we can avoid those patients. Patients that have severe gum disease, and you just look at the gums and they bleed, this is how bad it is. Again, we exclude those patients because we need a clean, healthy environment to do our work. Otherwise, we're contaminating the work field. So, so again, being selective in those cases. Who are the patients that are eligible? Again, depending on the equipment that you have, on the doctors that you have, could be a lot of percentage of patients are eligible. We can do, like you mentioned, can we do a perfect smile in one day? Yes, we can. We can do veneers for your teeth. So in one day you will do veneers in the upper teeth, and we'll do all the other work, and we'll do maybe like whitening if you want in one day. It takes an hour and a half. We can do whitening, whiten your teeth. So yes, this can be done. A lot of clinics are doing it too, so we're not the only one. But again, you have to kind of categorize those patients, see if they're eligible or not.
Now, Dr. Kennaan, we know that aesthetics, they are becoming everything nowadays. People don't really care as much about the interior as much as they are concerned about the exterior. So you may see at least a lot of young people, and we know that Saudi Arabia has, mostly a population of the young people, that they are more concerned with the outlook. Now, veneers or plasma whitening or any other form of whitening, which is like laser whitening and quite a few others. Now, those also, do they do any kind of damage, any kind of harm to your teeth? Because we have a lot of people who are very, very religiously going to dental clinics and having those kind of whitening procedures done even.
Speaking of whitening, by the way, I wrote an article a year and a half ago in the Sharq Al-Awsat magazine. After doing a lot of research on the whitening in the market, and I checked the research, the most recent research in the market, they all show that the whitening in the office, which takes an hour with the laser or the zoom like we have in the office, you can do them once every month, and it's harmless. The only thing with the whitening, it doesn't damage the teeth, by the way. It doesn't affect the teeth at all. The only thing it does sometimes causes sensitivity. Most of the new materials that they're using is they embedded in that material they're using, they're embedding some anti or desensitizing materials inside the gel, so it doesn't cause sensitivity. So now the sensitivity is almost down to 93% only. People become sensitive. So the research showed that you can do it every month of the year for a year. Or you can do the home whitening kit. You can do it almost every 2, 3 days, 4 days. You can do it the whole month without causing any damage to your teeth. What the funny thing is, in the research, one of the researchers that we're talking about, they said if you do the whitening in the office, and then you get take-home gel with the take-home trays, and you do the trays every 4 months. You do it like 3 or 4 nights. 4 or 5 years. So you got the zoom done today, the whitening done today, and after 4 months you did the home bleaching for 1 or 2 nights, and then 4 months you did 1 or 2 nights, and then 4 months and 4 months. For 5 years, the research says your teeth become permanently white. So it's interesting to know about that research. They did a 5 years follow-up, I think, with 120 patients. So, so there is some good things about the whitening. Now you have to be also selective. If you have sensitive teeth to start with, maybe you should avoid those whitening. Maybe just do it once every 2 or 3 months instead of doing it all the time.
Let me be more precise to ask you, Dr. Kennaan, what I really wanted to ask, which is a concern for myself mainly, being whitening freak as well as a lot of other people too. That does it actually happen that eventually with time the thinning of your teeth start because of such extensive whitening procedures?
No, it doesn't. So it has no effect on the teeth at all. The whitening, all it does is it penetrates the surface of the tooth. The tooth consists of tubules, which are little canals, like little straws, from inside to outside. The gel comes in, it penetrates through these tubules and whitens those teeth. So what it does is goes in and bleaches those teeth, those tubules, to get all the staining off. And as soon as you remove it, you have tubes that are white and there's no staining in them. And just going to be a matter of time before now your Pepsi and your 7-Up and all your...
You mentioned the brand, so carbonated
the
drinks.
Pasta, yeah, the pasta and all the stuff will go inside the teeth. After 3 or 4 months, now your teeth become a little dark again. So it doesn't affect, there's no effect on the teeth. It's not that we use, it's not like acid stuff that we use. We don't use any acids, all carbocanes, which is material that all bleaches, but it doesn't have any effect on the teeth.
Now, pertaining to this, another question that comes to my mind is we're always or often asked not to eat or drink anything which is non-white in color after the whitening procedure. Why is that?
Again, when you bleach the teeth, when you use the whitening, those your little straws, you went inside, you clean them. Now those straws are still open. So usually after you get the whitening done, you remember what you do? You put fluoride on the teeth. The fluoride kind of closes up those little tubules, those little straws. But it doesn't close them 100%, so you still have some straws that are open. As soon as you drink something colored, it's just going to suck in inside the tubules, and now your teeth become even worse than they were before you started with.
Now, even the home dental whitening kits, do they have the same problem that you're not supposed to drink like, dark color carbonated drinks or these orange or green carbonated drinks?
The home bleaching, they are a little bit less concentration, okay? So now the office, when you use it for 15 minutes, and then you clean, wash, and then you put another application, they are very strong. I think like 40 to 50 degrees percent concentration. The one you do at home, they range between 11 to 16 sometimes. Some of them are 20, it depends on the material. But again, they're a little weaker. That's why you wear them overnight. And you use it for 2 weeks, every night for 2 weeks. So they're a little bit weaker, so it doesn't actually open the tubules as much. So it's like a little slow effect. And we always expect a little, relapse. We call it a relapse. Just a little bit color would change after you finish the whitening, which is expected.
Certainly. Now, Dr. Antonio, let me ask you this. When we are talking now about, mostly the enhancement procedures and the basic outlook for the teeth, but talking about your contribution to these one-day dental treatments, now, how often is it that you actually get patients for these miracle one-day treatments who are actually requiring the services which you are providing? Because what I can understand is that most of the people are just, concerned about how their teeth are looking.
Okay, we need to take a look and take care about, for example, the one that is going to do the crowns and everything. He will do a preparation. He will burr, he will grind the teeth. Then we will get closer to the pulp chamber, the nerve. So then a lot of sensitivity will come out. Then we have to evaluate if, with the crown, we are going to remove to heal the tooth from this sensitivity, or it's better to go ahead for the root canal. The patient comes with a big decay, then we need to clean up the decay. Mainly sometimes, we're talking sometimes around 80–90% of the times, these decays are almost in the pulp, in the nerve. So we need to go ahead for the root canal. And a lot of patients are coming here with big decays, with the nerves completely compromised. And as I told you, if we need to do the root canal, then we need to take a lot of care, because my work will be the main foundation for the outcome.
Now, Dr. Antonio, you're in private practice, and in private practice, it's clear that you would be having like people, from all different nationalities. So you're having like all the expatriates coming to the clinics, as well as a lot of Saudi people. Now, do you think that tooth decay and those kind of dental problems are really prevailing in our society in the kingdom, especially in Riyadh?
Okay, then we can talk about one, 50-50? Maybe
How do you find like, the overall dental health from your perspective of seeing so many patients on a day-to-day basis in your clinic?
Okay, mainly my perspective will be that Saudi's oral care, it's not as good as foreign. But when you go to root canals, that we know that root canal is like the last step to save the tooth. We are talking about that I'm getting around 50-50%, 50 foreigners, 50 Saudis to get go ahead for root canals. But mainly Saudi oral health is not as good as expats oral health.
Now, well, on this note, we are going to move on to our guest who's joining us from UK, Dr. Rahman Bedi, who is the head of the International Center for Child Oral Care in London. Hello and welcome to the program, Dr. Rahman.
Hello.
Now, Dr. Rahman, basically here in Saudi Arabia, we have a new concept of the one-day dental treatment, and we have been pondering upon those lines. We are talking about this particular one-day dental treatment and what are the facilities and the services that it is providing to the people. But now, coming to you, as you're joining us from UK, what I would like to talk to you about is that are those kind of treatments having any popularity in your part of the world?
Dental treatment on a one-day basis has always been popular for selected groups, and I was impressed by the categories: anxious patients, patients who travel for a long distance, who require one-day treatment. But I think most people want is quality care, and it's possible today to do that for selected groups of people on a one-day basis. But there's another issue that you raised as well, which is the dental caries levels in Saudi Arabia, which is of great concern. And even the Saudi Dental Society just a few weeks ago announced that there's an oral health crisis in Saudi Arabia.
Now, Dr. Rahman, talking about UK, let's say, how common is dental caries, especially as we see the prevalence of dental caries in most of the cases here, at least, in the school-age children?
Dental caries levels in the UK are one of the best levels in the whole of Europe. We have levels which were similar to Saudi Arabia in the 1980s. So the evidence base is that Saudi Arabia had similar levels of dental decay in their 12-year-old population as the UK have today. In the 1990s, we saw a rapid increase of decay in Saudi Arabia, and it was what would be considered as moderate levels. Now, we have one of the worst rates of dental decay as seen in any child group in the world. And that's why the Saudi Dental Society called the situation an oral health crisis in Saudi Arabia, which I firmly agree with.
Certainly, Dr. Rahman. Now, coming back to the studio with our guest joining us here. Now, Dr. Kennaan, the question that I asked you before too that we did not mainly talk much about is the age group. Now, can young people come over to avail the services in the one-day dental treatment, let's say when it comes to, you know, the overall enhancement look?
Age group is not a big difference. It's not a big deal here. We can do children, like the speaker talked about from London. We can do children. A lot of clinics actually in Saudi Arabia, or a lot of hospitals, they do children in one day under GA, so under general anesthesia. They put them asleep, they wake up and all done. Especially for those apprehensive patients, and especially for those patients that have a lot of decay, a lot of cavities. We do it at Sulaiman Habib, the Dalla Hospital will do it, Mamlaka Hospital will do it, Kingdom Hospital will do it. A lot of hospitals in Saudi do these. As far as us, we have like 5 or 6 clinics, GA clinics in Sulaiman Habib Hospital. In Ajaji, we don't have the GA facility there, so we do mainly just local anesthetic. This is as far as the kids concerned. As far as adults, we focus on those. Age is not a big deal. Usually, like I said, it depends on the needs of that patient, and it depends on whether they qualify or not for the one-day dental treatment.
Now, we talked a lot about the things, the possible things which could possibly be done in these one-day treatments, but you did not tell us, Dr. Kennaan, about the things which cannot be done. You told us about the patients who are not eligible for the one-day dental treatment, but are there certain things which cannot be done?
Like I said, if a patient comes in with a big abscess, a swelling in the mouth, and you want to extract that tooth, we cannot do an implant. Correct. Or sometimes we cannot even extract that tooth. So that's not qualifying one-day dental treatment.
Now, let's talk a little bit, talking about aesthetics. We know orthodontics play a very, very important and major role. Does that come into the one-day dental treatment as well?
You can start with orthodontics and one-day dental treatment. Let's say
you can start with it.
Yeah, like you put the bands, or you have the impressions taken before you put the bands. After you finish, let's say, the fillings, and you did the cleaning, you did the crowns and the bridges the patient needs. Now we need to do all the root canals, and now since the patient is here, let's put the band on the patient. So you can start, but again, orthodontic treatment involves moving teeth, and moving of the teeth usually takes time, so you have to move it slowly, otherwise you damage the teeth. So ortho is not one of those things that you can start and finish in one day. We can do, like we said, veneers in one day, so that's possible. We have the technology that we can do veneers, maybe like 6 or 7 hours. We can finish all the mouth veneers, made either with the filling veneers, or we can do a laminated veneers, which is made in the lab by certain machines that we have.
And veneers, like, they are the ones which give you the celebrity smile.
That's Hollywood smile as veneers. Yeah, you can get the color that you want, the shape that you want. Again, there's certain cases that you cannot do veneers if you have teeth are too much far apart or too much wide. You have to get, you know, orthodontic treatment, braces.
Tell us a little bit more about these veneers, these dental veneers, because, you know, they have been popular for quite a while.
Again, veneers started a long time ago, like, you know, now the latest in veneers technology is you can do veneers without shaving or touching the tooth. You can just take an impression and the lab will make those veneers. The thinner they are, that's the technology. So if you can make veneers that thin, that's...
So veneers are basically designer clothes for your teeth.
Exactly. It's like you're wearing a jacket. I'm wearing a jacket. I want a you know, black jacket. I can be, you know, black jacket. I can have the whitest jacket. All I have to do is just wear this little thin jacket and I can cover myself. So veneers are basically something you put on the surface of the tooth, which give it the color, and you can shape it the way you want. You want to make it fat, thin, long, short, whatever you want.
And how long do they last?
Okay, that's a good question. It depends on the patient. Sometimes veneers last maybe 15, 20, 30 years.
So is it like the less you would use your teeth, so if you drink more and eat less, it would perhaps...
yeah, and you lose weight too.
So how is it? I mean, seriously, Dr. Kenneth, I mean, how long does it last you? I mean, actually, can it last you for years?
It can last you a long time. It depends if, let's say, one of those people that like to grind the nails, you know, like this. You know, if you like people that like to eat seeds, you know, and those front teeth there. If you're one of the people that like to open the Pepsi can with your teeth. So if you misuse your use your teeth, you know, mistakenly, you know, by doing things that you're not supposed to, any pressure that we put on those veneers, it can fracture. Usually they don't pop out. Usually they fracture, they break off.
They chip.
Yeah, chip. So easy, we can just remove them.
That means that the damage that you may possibly do would be done to the veneers and not to your teeth.
Exactly. So you can just drill it out, clean it, and put another one. So simple as that. So some people will ask them, as far as the color will never change. So that's, you can get permanent color for their teeth.
What is the ideal color for the teeth? I mean, some say that the white of your teeth should match the white inside of your eye. Is that true?
That's the first time I hear that. What do you think, Doc?
Okay, it's a really simple comparison. Once in my home country, I had a patient, and he told me, I want my teeth as white as that guy. It was a black guy. So because of the contrast of the skin, then his teeth look even whiter.
Yes, that's true.
When you get a tooth and you remove it from that environment, the contrast of the skin, and you put it besides a tooth of a white person, then the other tooth will be even yellower than yours. But how white it can be, there are shades and everything, but it's up to the patient. We can take it the whiter we can, as long as we can, and that it will give a good contrast to the patient.
Would you like to comment upon that, Dr. Kenneth?
Yeah, I had a patient 2 weeks ago. She came with her husband, and she was standing across the chair there, like she probably about 3-4 meters away. And I was like, as soon as she walked in, I was like impressed with her teeth color. They're so white. I was like, wow, you know, in my head, I'm thinking, wow. And then she goes, after talking to her husband, she goes, you know, Doc, I want to whiten my teeth. I was like, what? You know, what do you mean? You know, your teeth, you know, by the way, your teeth look so white. I don't think you need to do anything to them. So again, it depends on patient mentality. If somebody thinks their teeth are yellow, they can get whiter. Sometimes the patient comes in, they have very bad yellow teeth, and they're happy. It's like, no, my teeth are white. I'm happy with them. And some people come in with the, you know, the whitest color. You look at the shade guide. We have a shade guide. You look at the shade guide. The whitest color is this. And look at her teeth. It's like even whiter than that color. So again, you have to be really careful promising a patient or somebody that you can get their teeth whiter than they are, which you can't.
Certainly.
So expectation is very important with whitening, especially with the cosmetics.
That's right, Dr. Kenneth. Now, let us quickly move to our guest from London, Dr. Rahman. Very quickly, what I would like to talk to you about is that how important it is to take care of a child's teeth in the early ages of his life in order to give him a good foundation for the future, and talking here dental-wise.
It's absolutely important. I mean, I like the concept of the one-day treatment, but, you know, I'm a parent of 3 boys. You can provide dental treatment under general anesthetic for children in 1 day, but you can't provide care in 1 day. So the treatment, you can fix teeth, that's easy enough, but prevention is everything. to explain to parents and the child what it means to look after their teeth, how to look after their teeth, how to use fluoride effectively. These are communication situations and a relationship that needs to be built up over time. So prevention is everything. I mean, if we don't get the prevention right, yes, you're going to spend a lifetime having fillings and root canal treatments. If we get the prevention right, when a child leaves school at 16, there is no reason why they should ever have a filling. There is no reason why they should ever need restorative treatment. This, half the population in Northern Europe enjoys. And this is what we need to aim for in dental care for young children. And Saudi children, unfortunately, I don't think, are getting that type of care.
Certainly, Dr. Rahman. So with this, we would like to thank you very much because we are short on our time. But thank you very much for your valuable contribution to the program. And we are definitely trying to bring up the criteria of Saudi oral health between adults or children.
Thank you very much.
Now back to the studio with our guest, and you know the very interesting discussion that we have had today in the studio about this one-day dental treatment. Now I'm sure that a lot of you are having high expectations, but Dr. Kennaan has already mentioned earlier that you need to have realistic expectations, especially talking in terms of dental whitening. Now Dr. Kennaan, as Dr. Antonio mentioned earlier too, that if you go ahead with any kind of dental treatment, you need to be having checkups to follow up with the treatment that you took. Now, how does that apply to the case of one-day dental treatment?
Like Dr. Rahman said, you know, one-day dental treatment, we do the care, we do the work on that patient, and now it's all up to the patient. What can they do? Can they maintain the work? Like I tell most of my patients, you know, you're spending a lot of money to do, let's say, implants or treat your teeth. You're spending thousands and thousands of riyals. That money that you spend, imagine that money is as an investment. You know, you have to maintain your investments. How? By keeping good oral hygiene, do the regular checkup with the dentist. All the work that we've done, it needs maintenance. You buy a car, and if you don't change the oil, you don't change the tires, the car will go bad. So you have to maintain that. What we do is with the one-day dental treatment, after we finish treating the patient, we schedule a follow-up visit, which is after 6 months. We book them again in 1 day with the dentist to do examinations and evaluation, and also with the hygienist to do the cleaning. The cleaning also in our clinic is we combine cleaning with oral health like education. We give the show them how to brush, how to floss the proper way, what toothpaste to use, what toothbrush they have to use, depending on their mouth, soft or hard. Toothpaste have to have fluoride. Like, let's say, one of the things that about the Saudi population is a lot of the patients I notice coming from the U.S., a lot of patients that are using...
There's no water fluoridation here.
They have a little bit, but the toothpaste they use mainly here is miswak. And I was talking to one of the speakers from Sweden. He did a lot of research on the cavities in Sweden, and he said miswak, they don't have fluoride. So that's a big issue. If you don't drink a lot of water and drink a lot of Pepsi, by the way, that's damaging to the teeth, and you're using a toothpaste that doesn't have fluoride, you're not protecting your teeth. So this is one of the things that we recommend those patients with the cleaning is the oral hygiene consultations and care.
Certainly. Now, let's say, Dr. Antonio, we cannot skip certain kind of dentists, but doctors like yourself, when it comes to endodontics, we can easily skip coming to you, given if we maintain proper dental hygiene. So, what would be your advice? I mean, you know, this is what I would like to ask you in the end of the program as to what would be your advice to the people. How is it that they can prevent coming to dentists like yourself?
It's really easy avoiding coming to the endodontist, and it's taking a very good oral health care, hygiene. It mainly depends. Some people say don't eat candy, don't eat gum, because that will tear apart your teeth. We can eat anything as long as we take care of our teeth and brush them and correctly floss them.
Now, flossing, how often is it that you need to floss your teeth?
Okay, there is not like a criteria on health flossing, but mainly myself, I do it twice a day.
Twice a day?
Twice a day. And, but I guess once a day in the evening, it's just okay, just before going to bed. I believe flossing one time, it's okay.
So it's the proper kind of brushing, the right use of toothpaste, flossing at least once in a day, and of course followed by using a good mouthwash, or if you can, a tongue scraper perhaps.
Exactly, and as well as the regular checkups.
Certainly. With this, Dr. Antonio Flores, we'd like to thank you very much for joining us, and also Dr. Ahmed Ali Khannan, we'd like to thank you very, very much indeed for opening new doors to us in terms of the one-day dental treatment.
Thank you.
Thanks to you.
And well, so dear viewers, that was all the time that we had with our guests, and as you all are getting more and more accustomed to the medical news, so stay tuned, as up next is medical news. The medical news that we have got so far is a press release, and the Ministry of Health has announced that the health requirements of the 1430 Hijri pilgrims would be that the ministry has also made notifications that the stakeholders to circulate such requirements upon the embassies of the custodian of the two holy mosques, in addition to its representatives abroad, in order to regard with cases of declaring the visas of their Hajj permits and Umrah. Now, Dr. Khalid bin Mohammed al-Merghlani, the Ministry of Health spokesman, has clarified that the ministry continues the epidemiological developments of the diseases, and the entire stakeholders will be reported about any new amendments upon the requirements, mentioning that the current health requirements have focused on various axes such as the yellow fever, meningitis, polio vaccination against influenza virus, and food. Moreover, Dr. Merghlani has also declared that the requirements have provided that the countries with the yellow fever are Angola, Benin, Sudan, Senegal, Burkina Faso, the Republic of Middle Africa, Cameroon, Burundi, Chad, Uganda, Congo, the Ivory Coast, Sierra Leone, Somalia, Ethiopia, Democratic Republic of Congo, Gabon, Gambia, Ghana, Guinea, Equatorial, Guinea-Bissau, and a lot of other such countries from that particular group. Now, he also mentioned that the pilgrims from such epidemiological countries have to present a valid certificate of vaccination according to the global health regulations, assuring on the vaccination against such diseases before reaching the Kingdom of Saudi Arabia within the period of 10 days. And furthermore, planes, ships, and the other transportation means coming from the epidemiological countries are required to present a valid certificate stating there is no insect on it. Now, for meningitis, Dr. Merghlani has declared that the requirements assured that the pilgrims from outside the Kingdom of Saudi Arabia have to get the quadruple parity vaccine as a basic condition to get the 1430 Hijri years Hajj and Umrah visas for their countries. Now, therefore, all such countries will bear the resultant responsibilities of that issue, and the pilgrims and the seasonal workers within Hajj region will be required to present a vaccination certificate against meningitis, showing that he has been vaccinated within a period between 10 days to 3 years. Meanwhile, the health stakeholder have to confirm of the implementation of the vaccination process of adults and children from 2 years and with a single dosage of the quadruple vaccine. Now, for the pilgrims from the African belt states, the average of carrying the infection in addition to the quadruple vaccination they have already got into their mother countries. Now, Dr. Merghlani has also declared that the requirements regarding to polio, the embassies of the custodian of the two holy mosques in Uganda, Kenya, Benin, Angola, and a few other places have to vaccine the children less than 15 years with the oral polio vaccine before coming to the kingdom within 6 weeks, along with presenting a certificate that proves it. Now, they will also be vaccinated by other dosage, the oral polio vaccination, at the time of reaching the kingdom. Now, Dr. Merghlani has confirmed that the entire visitors from the epidemiological countries with polio are required to be vaccinated with oral polio vaccine in 6 weeks before coming to the kingdom. The kingdom's Ministry of Health has recommended the home and abroad pilgrims to get the seasonal human influenza vaccine, which we know is getting on the rise before going to Hajj or Umrah, in particular the elders and the people with chronic illnesses, diabetes, and cardiac and hepatitis complications. Dr. Merglani has also clarified that the ministry in its requirements has prevented the visitors to enter any foods to the kingdom unless these foods are canned or in easy open vessels that will be enough for the quantities during their journey in the kingdom. Now, he confirmed that the case of a worried emergency health state within any countries have been infected with such serious diseases, so the kingdom's health authorities will take extra precautionary steps towards those who come from such countries. And well, so that was the press release from the Ministry of Health, and mainly the important points which Dr. Merglani has mentioned during it. Now we will move on to some more developments here within the Kingdom of Saudi Arabia in terms of the medical news. Up next.
The reason why this association was established was that because its establishing members recognized that there is a big gap in the services and awareness available about Alzheimer's disease, despite the fact that it's almost becoming an epidemic around the world. And so for that reason, a group of enthusiastic members decided to make all possible efforts in establishing this association, and alhamdulillah it was established a couple of months ago, and today is the opening ceremony, so that the dream became a reality. I think the reason why it was not established previously was that there wasn't enough, let's say, individuals who had enough training in this area so that they would push the association to start practicing on the ground, on the floor. So wishes were around, but there was no people who were trained to do the job themselves. Alhamdulillah, now there is more and more specialized individuals in this area, and hopefully with the establishment and the support that this association will have, the actual work will start to be happening very, very soon, and it will be visible for everybody in this country. This is one of the deficits that we have identified, which is that we don't have official statistics about this illness or the people who are affected by it. What do you expect? We expect that we are not that much different from the rest of the world, and in the rest of the world there is about 5% of older people who have dementia, and one of the most important causes is Alzheimer's disease, and in Saudi Arabia that figure translates to about 50 to 100,000 individuals around the country. So this is the figure, this is the number of people we expect to be affected by Alzheimer's disease. Okay.
Alzheimer's is a disease that is mainly focused on the central nervous system. It affects old people, usually starts at the age of 65, and it doubles the percentage every 5 years, where people at age of 85 and up have a 50% chance to have the disease. It mainly affects memory, but as the disease progresses, it can affect everyday functions until death. There's no known cause, but some studies show that trauma or brain strokes can affect the brain function to cause Alzheimer, and familial or genetic disposition can cause Alzheimer, but there's no known cause. This is actually one of the reasons the Alzheimer Association, we don't have specific numbers or epidemiological studies about the disease in Saudi Arabia.
Alzheimer is a degenerative disease of the central nervous system. It starts usually at old age, around age 65.
Do we have a fixed age to have this?
Yes. There is no fixed age, but some people have a genetic predisposition. Okay, some people may have it around in their 30s, in their 40s, 50s, and normally Alzheimer's is caused by old age, at which case they would get it after the age of 65.
And also, dear viewers, that was the inauguration of the Saudi Alzheimer's Association, and during the ceremony we saw the presence of His Excellency the Minister of Health, Dr. Abdullah Al-Rabia, and His Royal Highness Prince Ahmad bin Abdulaziz, the Deputy of the Interior Minister, is the one who inaugurated this ceremony. And so we would like to really congratulate them on this achievement, and we would like to thank them as well, because we know that Alzheimer's is a growing disease with old age. But well, however, pertaining to this edition of the program, we would like to thank you for accompanying us through the show, and we really do hope that all of you are going to have more confidence in your smile as well. A smile is something that uses the maximum number of your facial muscles, and a beautiful smile can really light up your day, as well as definitely light up your face. And so we wish you all a very beautiful smile. And well, for the ones who don't have it naturally, now with the help of the one-day dental treatment, they know that they have a solution. We wish you all the very best of health until we meet again next time in your own health show, The Medical Files. With myself, Saima Aziz, and the whole team of Medical Files, we'd like to say to you, Assalamu alaikum wa rahmatullahi wa barakatuh.